okay, what do you guys think about starting a ketamine clinic? And it was 2020. It's just a weird time. Yeah, let's give it a shot. And lo and behold, here we are 4 years later. And I think we all really love what we're doing. You have to have a passion for this. That's really important. Don't go into this for the money. Know that you're going to make an impact and know that you must have a passion for this. What is your driving force? What's your real motivating factor?
3, 2, 1. Lift off.
Welcome to the Ketamine Startup Podcast. My name is Kimberly Chan Ko, and along with my co-host and partner, Sam Ko, we're two physicians who have a ketamine infusion clinic in Palm Springs, California. But more relevant to you is that we've helped multiple physicians and other licensed medical professionals start ketamine clinics or add ketamine infusion therapy to their practice across the United States. In this podcast, we go over the realities of operating a ketamine clinic, marketing it, and more. In today's episode, Sam sits down with Dr. James Leathem, an anesthesiologist and co-founder of Advanced Wellness and Pain, a ketamine infusion therapy clinic which has multiple locations in Arizona. Dr. Leathem shares his unique journey into the realm of medicine, from anesthesiology to ketamine treatments. Together, Dr. Leathem and Sam discuss the impact of ketamine treatments. Let's dive into the challenges of operating ketamine clinics. Dr. Leathem offers charismatic insight into the power of mindset, gratitude, and authenticity in healthcare, and ponders the future potentials of therapies like MDMA. This is a wide-ranging conversation that even ends with Dr. Leathem sharing his freestyling rapping talent. Let's jump into the episode.
Welcome to the Ketamine Startup Podcast, James. It is really an honor to have you on. Thank you for making the drive out here and being here.
Honor and a privilege to be here. Wow, this is like full circle for me. Like just the whole reset ketamine thing. I was thinking about resets even before I met you. So I think it's almost just like serendipitous that we get to be in person and do this. And I'm on my way to LA right now. I'll be in Santa Monica tomorrow. Finally taking a week off from work just to fill up my own personal cup so I can pour back into patients. And I had to make a stop through here to see Dr. Sam Ko, man. You're a leader in this space. You really are.
Thank you, James. I believe in synchronicity. So the fact that we connected many years ago and now we're here doing this transformational work, it really is an honor for you to be here.
Totally, man. Yeah, 2021, we met at Meet Delic in Vegas. And then I remember you challenged me to make content because I was so impressed with your content. And then I did my ketamine integration poem later on and gave you a shout out. So this is really cool. Like you challenged me and I had to answer the calling. I was like, dude, you got to.
You did it, man. You're courageous.
Fear and courage. We could talk about that as well. Like doing things in the face of fear. That is courage. Both of us, we are, man. Like we're really just trying to make the world a little bit better place. And this is an alternative medicine, but it's real medicine. And I think people just need to know about it. Honestly, it's raising awareness, it's educating, it's informing, and also entertaining a little bit and having a good time. We're just regular human beings that were crazy enough to go to school for a long time. And then now knowledge is power. We have to use that to help others. And with great knowledge comes great responsibility. Spider-Man.
And I learned it was actually Spider-Man's uncle.
Yeah.
But then someone else told me it was actually...
With great power comes great responsibility, or?
I think it was like Nietzsche or something, who actually, the OG author of that quote.
Yeah.
Sometimes we'll hear a quote and say, oh yeah, it came from Mark Twain or Albert Einstein, and it's actually...
It's still a very profound, condensed wisdom to know. With great knowledge does come great responsibility.
Yeah, it's like essential wisdom.
100%.
Right? Distilled for millennia.
100%.
That actually leads to the first question. And speaking of Spider-Man and stories, tell us your story, James. How did you end up being where you are today?
There's a lot to it, but they call me Dr. James. I got psychedelic blood evolution in my veins. Now, I'm going to spare you the rest of that rap because we'll wrap it up with a rap. But just where I came from, I was born in Connecticut, Hartford, Connecticut, actually. Ironically enough, the birthplace of anesthesia was actually Hartford, Connecticut, not Boston with the Ether Dome. 1844, Horace Wells, a dentist, gave nitrous oxide, which was actually technically the first anesthetic. So I was born in Hartford, Connecticut, and that's also where the first anesthetic was ever done. And I'm an anesthesiologist. Just irony, synchronicities. We're going to have a lot of those today. Raised in Connecticut, from the Northeast. Honestly, I never knew I was going to be wanting to go into medicine. Really, it all culminated when I was 21 years old. I was in school in Florida, Southern College in Lakeland, Florida. I was a business major. I played college baseball. And then these two wild things happened to me, October 2002. It's going to get serious for a moment, but this is my story. So you want to hear the story?
Definitely.
At 21 years old, my dad drowned. He was 47. And then 2 weeks later, my appendix ruptured, and I was in the hospital in Lakeland, Florida. And October 27th, 2002, the Giants played the Angels, Game 7 of the World Series. And that night, I had an epiphany and decided I want to become a doctor. But it was also spawned by psychedelics. Why? Because in 2002, when I was in the hospital, I had a lot of nausea, I had pain, I had ruptured appendicitis. And they were treating me on antibiotics because I was perforated. I couldn't do surgery right now. You do an interval appendectomy. And my roommate, I was like, dude, I got nausea, I got pain. Can you bring some cannabis to the hospital? 2002, mind you, felony at the time. I literally met him outside the hospital with my IV pole. I took a couple hits off a bowl, went back up to my room. I had no more pain or nausea. And as I'm watching the World Series, I decided I wanted to become a doctor. And I thought I was hallucinating. I thought I was telling my nurse I wanted to become a doctor, all this stuff. I was like, did I really tell her all that stuff? The next morning I woke up and I was like, dude, you still want to do this? And I checked within myself and I was like, yes, I do still want to do this. That was 2002. I didn't start medical school until 2007. So it took me 5 years to get to med school. I still finished my undergrad business degree, majored in marketing management, which now has some application as a business owner, entrepreneur. And then worked as an EMT, pharmacy technician. I shadowed surgeons. I shadowed nurse anesthetists. That's why I started to see anesthesia because I really thought I wanted to be in the OR and be a surgeon. And I remember the surgeon I was shadowing, the spine surgeon, a friend of my family. And he goes, hey, stand with anesthesia. You get a better view. And so I'm sitting there with the nurse anesthetist. And slowly but surely, my interest shifted from one side of the curtain to the other. I was like, what's going on here? This is interesting. They call it the blood-brain barrier, a joke in medicine. And this is back in early 2000s. He let me intubate a few times. I was a volunteer, in the emergency department there. Nothing happened wrong, of course, right? But just it was a different day and age. Before social media, really, Facebook came out in 2004. So this was basically 2004, 2005, early days. Almost seems archaic in a way, 20 years ago. So that's when my interest shifted from the surgery side to the anesthesia side. And it took me 3 times to get into med school. I was not taking no for an answer. So I had no doctors in my family. I used to always have that imposter syndrome, can I do this? I don't have the doctor blood, right? And you can do it because I'm going to tell anyone listening here, realize that anyone that's ever done anything of significance on this planet, what are they? They're a human. And what are you? You're a human. So it's not that you can't do it. It's just that you think you can't do it. So you have to believe that you can achieve it and you will likely be able to make it happen, especially if you're betting on your mind. If you want to be if I want to be an MBA, come on, I'm not that tall. It's not realistic, but maybe if I practice, I could be good at 3-pointers or something. But at the end of the day, it's me versus me. That's why we're as the bracelet, because it's you versus you of yesterday. That's really what it is. So get out of your own way. Don't be afraid to fail. FAIL, first attempt in learning. So fail forward, learn from your failures. So I look at life as win or learn, not win or lose. So long story short, got into med school, started med school at Midwestern University in Arizona. I'm a DO, Doctor of Osteopathic Medicine. And then when I was in med school, you got to figure out what specialty you want to do. I was actually between 3. It's very ironic as well. Anesthesia, psychiatry, and family medicine. And now I basically do all 3. And I feel like I found my ikigai. Now, find what you love, what you're good at, the world needs it, you make a living from it. This is truly my ikigai. It is just ironic that I would find this field because I was working in a hospital as an anesthesiologist. 2019, we lost the anesthesia contract with the hospital. There's been a lot of venture capital takeover of different anesthesia groups and things. We won't get into that. It's a whole nother rabbit hole. So we left the hospital in 2019. I just became a partner in that anesthesia group, big buy-in and all these things. And I was always told in residency, that's what you do, become a partner. That's what your goal should be. And then 2019, we left. We started doing pain management sedation. My brother's a pain management doctor. Shout out Dr. Jarrett Leathem, Advanced Spine and Pain. Amazing. If you're in Arizona, check them out. They'll get you relief ASAP. AWAP. So a little cohesiveness there. Advanced Spine and Pain, I'm Advanced Wellness and Pain. The brothers. He's my younger brother too. We never would have known, we got to work with each other. I probably did a few thousand cases with him. He's on one side doing the pain procedure. I'm on the other side of the curtain doing the anesthesia. Really awesome. Just really cool that we got to do that. And then we did that for a year and a half, 2019 and 2020. And it was me and Dr. Wong, Dr. Sharma, and another doctor as well. She left the group. And then in 2020, COVID happened. I had to adapt, right? And I realized I have no work. There's no elective surgeries happening. A lot of the pain management procedures are elective, so you couldn't necessarily do it. And I just realized I had a moment of clarity. Wow, I'm really not in control of my own destiny here. Who really is, truly, but still, I'm always responsible, I'm relying on a surgeon or proceduralist to bring me the cases. And I was like, I want to take matters into my own hands. I have knowledge, I have skills. I know there's ketamine clinics out there. I think I could do it better. So I talked to Dr. Wong, Dr. Sharma, was like, hey, what do you guys think about starting a ketamine clinic? And it was 2020. Is this a weird time? Yeah, let's give it a shot. And lo and behold, here we are 4 years later. And I think we all really love what we're doing. You have to have a passion for this. That's really important. Don't go into this for the money. Know that you're going to make an impact and know that you must have a passion for this. What is your driving force? What's your real motivating factor? And I do the reset thing too. Sorry, I'm very tangential. A lot to this story. But when I was 2013, when I was in residency, I used to tell people, I want to start a clinic called the Reset Oasis.
Wow.
Yeah, just ironic. So my wife actually found you on Instagram. She found the Reset Ketamine. And I was like, dude, this guy gets it. It's the reset button. I'd never heard anyone else say the reset. And I was saying back in 2013. And so I wanted to call it Reset Oasis, but it's actually Advanced Wellness and Pain. I want to do vitamin infusions and ketamine. But here's the thing is, when I came out of med school, I owed $280,000 of student loans. So like the reality is like, you got to go work in the hospital and make the for sure money before you can get out of debt. And then now I'm able to follow my passion. So when COVID happened, I was like, hey, here's my chance. I'd rather try and fail than never try and wonder. I'd hate to look back in my life like 7 years old and be like, man, what if I would have started that ketamine clinic? What could have happened? So now we're getting to live that. I'm sure there's challenging days, but just go back to your driving force. Why are you doing this? And for me, ultimately, this is my ikigai, like I said. I'm in Arizona. I love it there. I went Connecticut, Florida, Arizona. Residency was in Michigan State. You got to move to make life happen sometimes. And then got back out to Arizona. I'm crazy about AZ, capital AZ in the middle. It's amazing. It really is. What
was that moment for you when you were like, hey, this is the thing, AWOP, Advanced Wellness and Pain. Was there, like, you mentioned this epiphanies.
Yeah.
So what was going on at that time specifically, if you recall?
In 2020 for us to create Advanced Wellness and Pain, COVID was a weird time. I just was like, hey, I paid off my student loans. Let's take a chance.
Yeah.
I would tell you, dude, I'm authentically me as well. Cause like I encourage every human being, try to be your authentic self. You will attract your tribe. Now, when I was in med school, I used to tell like inner circle, dude, I just want to be a weed doctor. How do I go be a cannabis doctor? But if I went and talked to my dean, they would have kicked me out of school as a felony back then. And now it's legal. There's weed billboards all over the place.
Yeah.
So it's not that it was like
rescheduled soon.
Yeah, like I was just ahead of the curve. We're just ahead of the curve. So I knew psychedelic medicines are catalysts for consciousness, and I have personally used them. Now it's been 29 years. I have utilized psychedelic medicines, counting cannabis, as my first ever experience at the age of 13. That's like the 29 years. So I want to be the successful psychonaut that society tells you does not exist. If they do exist, there's a lot of them out there. So just know that these are tools for you exploring your consciousness. This will lead me into a really amazing quote by Dr. Carl Jung, famous psychoanalyst and psychiatrist. He's no longer with us, but he said, until you make the unconscious conscious, it will direct your life and you will call it fate. So make the unconscious conscious. And that's what psychedelic medicines have done for me. So now I'm realizing like, this is my calling. It truly is in this life. And like getting to help other human beings, that's what you want to do as a doctor. You want to make an impact. And literally as an anesthesiologist, I did like it. I was good at it. Like the world did need it, but you don't get that continuity of care. Like you treat them at a time of need and then you just never see them again. So you always wonder, hey, what happened to that person? And with this, I get to find out what happened to them.
It's really interesting because you mentioned you wanted to be a cannabis doctor back in the days, but you don't want to tell the school dean this.
Yeah.
So what was there a bit of fear with your colleagues, or because you were a successful anesthesiologist, you had I like to call them sometimes the golden handcuffs.
Totally,
If someone graduates from med school residency with 250, 280, 300K, I've even heard of like people graduating with $1 million.
Oh, nowadays for sure, yeah.
It's insane. So how did you handle that fear? Because I know some listeners may be thinking, man, it's scary because there's pushback. Hey, you're talking about being a psychonaut? Like that's scary. And so how did you face that challenge?
Really, it's fear, false evidence appearing real. So get out of your own way. Once again, me versus me. So I tell people everything you've ever wanted in life, I tell this to patients, it's on the other side of FUD. Fear, uncertainty, discomfort, and doubt. Everything you've ever wanted in this life. So you need to embody that and realize that honestly, it's trauma or difficult times plus healing that equals wisdom. No rain, no rainbow. No mud, no lotus. I don't make the rules of life. I'm just an interpreter. So I was like saying, okay, sure, I want to be this cannabis doctor, but I'm actually glad it didn't happen. And there's a saying that rejection is the universe's protection. So the fact that I didn't do that, I would have been then in cannabis, and now it's different because it's legal, and I would have missed being able to do this. So anesthesiology, it was the only specialty that real-time results of your actions. I love pharmacology and physiology. I was a pitcher in college. I love just like working with my hands. I had pretty good dexterity, good hand-eye coordination, all these little things, like attention to detail. And I really like one patient at a time. And so that's what I really liked about anesthesia. Like you'll know like within seconds pretty much, did I make the right decision or not? And I didn't want to be rushed.
Immediate feedback.
Yeah, and I really like that. And when it was the only time like where I would get like tunnel vision when I was in a case. You remember when I was a med student, it would intubate, and it was like everything got quiet, and I would just see those pearly white gates, the vocal cords, and I'm like, all right, this is my purpose right now. Even if I was cold right before then, and then you get to intubation, and as a med student, it's like everything. But then once you realize as an anesthesiologist, the intubation part's implied. Now you got to do the case.
I got to do the rest of it.
Exactly. And then That was my calling. Anesthesia is a perfect preparation for this because
absolutely.
ketamine is only FDA approved as an anesthetic. Technically, S-ketamine, sure, FDA approved for other things, but it's not the racemic or full molecule.
Right. Or IV.
Yeah, or IV essentially, which is, we can get into that too, because that is the preferred route of administration because it's so controllable and I can add on other medications. I can dial it up, dial it down. That's why I've coined it the most controllable psychedelic medicine experience on planet Earth. And it's legal. It is an incredible medicine. It's rapid acting. And it's all about, we've given ketamine as globally as a species, like billions of times on planet Earth. Like we know this medicine better than most medicines out there. And it's extremely safe. Sure, there can be harm with it. Like, everything's a tool or a weapon, but knowing that like it has so much application, like anesthesia, mental health, chronic pain, like different routes of administration, like it's lipophilic, crosses the blood-brain barrier. Like we're going to probably learn even more about it as time goes by. It's an honor and privilege to work in this space. This is my calling. And to be sitting here now with you discussing it, it's surreal to me. It really is. This is like a dream. It's just like a dream come true. It really is.
Yeah, I can really tell that what you are doing is aligned with your purpose and mission. Like
Thank you, man. I
definitely
appreciate that.
shows, James.
Thank you.
Seriously. I'm like, I see you. I see what you're putting out there. I see your philosophy, your approach.
Yeah.
It's quite unique, very holistic and biopsychosocial spiritual, I like to call it. And
100%.
you know, when we have something and we see it in someone else, we're like, cool, that is aligned. I know what that means.
Yeah. I look at ketamine or medicine in general. It's an art and a science. So I don't want to just give that infusion merely trying to get the proper dose and that's it. Like it's a Band-Aid approach that way. I'm trying to turn this into an experience, into an art form. And so I've had different visionary artists come through my clinic. I love visionary art. That's another thing we could talk about. And I've told them like, listen, I'm not good at paintbrush, but the art is medicine for me.
Right.
My application of medicine, that is my art form. And so it's like an honor and privilege to also give them those experiences as well. The earth without art is just
That's the way I see the delivery of ketamine. It is an art, and every doctor has their own way of making it. So I think of ketamine as like a set of paints and paintbrushes.
Yeah.
And it's, that's ketamine. It's a tool. You can use it in many different ways. You can create art in many different ways.
Mm-hmm.
So tell us about the way you do it at your clinic, because it seems very experiential, very conscious of setting, intentions. I'd love to hear about.
Totally. People come in from all walks of life. Some have psychedelic experience, some have zero. With the youngest patient I ever treated, 12 years old, oldest patient, 87. So all walks of life. So what I tell people is that we're going to approach this like we're just dipping the toe in the psychedelic pool the first time. But I do approach ketamine as a psychedelic medicine. So I think that's like definitely one of the lenses through which I'm approaching this, or like my paradigm at least. And psychedelic just means mind manifesting or mind revealing. Really cool the origins of that word as well, like Aldous Huxley and Humphrey Osmond back in 1956. To fathom hell or soar angelic, just take a pinch of psychedelic. And it was a letter between the two of them. So that's really cool that it came out back then. And now I think that psychedelic, the word too, has a lot of connotation to it. Sure. But I want to just be it as like mind revealing. It's not a scary thing. It's we're going to reveal your subconscious, unconscious mind to your conscious mind. And today, the first infusion, I just want you to relax. I just want to show your nervous system what it feels like to truly relax. But usually you're going to be around like 0.5 milligram per kilo per hour. I do at minimum a 60-minute infusion. I have reasons for that. Also, like a lot of what I do personally is based on my own personal experience with psychedelics and with ketamine as well. Like I had to have my partners immerse me in the medicine so I could try to really dissect this and come at it through the eyes of the patient essentially and pick out all the music, all the different art in the clinic. I really try to engage all 5 senses. So that's another thing we can go into, because every time you're engaging with a sense, you're getting more neural networks to come online. And so I look at like this web essentially that you're casting, and you're more likely to create like a neurologic imprint and a long lasting experience, the more senses you can bring into it. So doing essential oils and then picking it, so they have a little autonomy and it's like a little ritual for them, having them also go into the room and there's different artwork and there's green light in there. I use green light as a way to calm the nervous system. It was proven in a study at the University of Arizona. Green light therapy helps with migraines as well. Plus it's heart chakra. It's not polarizing, right? Roy G. Biv, red to violet, green's right in the middle. So it just really, green, I went through all the colors. I was in the medicine to really understand it, try to dissect it. So that's why I do that as well. Plus if you peek out while you're in the room, you're in that green light. It's not too bright or anything. But smell, sight, sound, I pick out all the music for you, right? So everything's curated. I've gone onto YouTube and Spotify and listened to all these music basically in the ketamine to dissect it and pick out different healing frequencies. So you just have to show up without food in your stomach, have your intentions, have done your preparation, work with your coach, come in with intention, of course, integrate the experience later. We look for active participation in our program. This isn't a passive, hey, give me the medicine, make me feel better, doc. This is you're an active participant in this. And then other things, touch, we do a vibration with the Apollo Neuro as a way to calm, or a wearable hug, essentially, quiet the amygdala a little bit right when you're coming into the infusion experience. That's our first touch point right when you come through the door. And then at the end, I'm going to engage with taste by giving you electrolyte popsicle. So now I've engaged all 5 senses. So that first experience, I know, sorry, I'm tangential. I've run around here a little bit. Each room also has a theme. So the first room is the wave room. And I realized with ketamine that things do get wavy.
Yeah.
And a smooth sea never made a skilled sailor. So we start off in the wave room and we're just dipping the toe in the psychedelic pool. So a lot of water theme, and water is life, essentially. We're like 77% water. And then the second room would be the cube room, where you get to the cube root of your problems. And then in the third room, it's the maze room, has a capital AZ in the middle for Arizona. So if I ever was going to branch to other, states or cities or something, that third room could be more to that region, essentially. And then the fourth room is the flower of life room, so sacred geometry. And then in that room is one of the master classes for ketamine. So we graduate you on your 5th and 6th infusion to a vibroacoustic meditation bed made by InHarmony Interactive. Shout out to Craig Goldberg. Brother, thank you so much. That's just trying to take the medicine to the next level. But that's not day 1. That's like your 5th infusion. And then the 6th infusion, if you choose to, you get to do the vibroacoustic therapy again in the space room, because I want you to go into inner space. You're a psychonaut, right? But just like outer space, astronauts can't go into outer space indefinitely. You have to come back to Earth. Otherwise, you would wither, you get atrophy. And if you go into inner space or being a psychonaut for too long, you also will lose touch with reality. So you got to come back to reality as well and integrate it. That's why we continue to move forward. So inner space, outer space, plus like I have a picture of the Earth on the wall just for perspective, right? At the end of the day, we're on a blue rock hurtling through space. It's going about 60,000 miles an hour, spinning at 1,000 miles an hour. That's wild to even try to comprehend.
Right.
You
and
can
we're
fit
the perfect distance away from the sun to have the oceans. And I imagine if it was like 10, 20, 30, 100 miles off, it would be a completely different planet.
Totally. It has to be tilted 23.5 degrees on its axis to have seasons. And so then since the Earth goes through seasons, we go through seasons as well.
Yeah.
The Earth is our mother. It's our host. And without the Earth, we would not be alive here right now. That was one of the things I discovered in some of my psychedelic journeys with ayahuasca in particular, was that the Earth is our host. It's our mother. Without it, we wouldn't be alive. So we need to have a symbiotic relationship with Mother Earth. And so I have the Earth there as perspective when you're in that last infusion, just that you're like, wow, am I sweating the small stuff right now? Because I'm going to tell you, most of the time we do. I try to summarize things with ketamine too, because it's a show you, not to tell you. It's ineffable. But here's one of my really good ones. So imagine all your problems as your thumb. Close one eye, bring the thumb right to your eyeball. That's how you are with your problems before you come to ketamine. And then after you go through the series of infusions, here's your problems. I did not take them away from you. I just changed your perspective with them, right? They're still there, but now I can start to see life outside of my problems. Like evolve your perspective. That's one of our slogans, essentially. Mm-hmm. It was one of the words I was saying more than any other word to people was perspective. And it's really like, am I suffering or am I thriving right now? It still comes back to perspective. Like even in like the darkest moments, you can still come at life through the lens of gratitude. And gratitude practice is one of the major things I try to teach patients as well. Your attitude determines your latitude. You got to look at life through the lens of gratitude.
Love it. And I think that's what Cicero said, is gratitude is the greatest of all virtues.
Yes.
Because it is the parent of all the others.
100%.
So it's so true. And actually at our clinic, one of the things we end with at the session is a gratitude closing ritual.
Beautiful.
And where literally everyone in the room goes in a circle and says, what are you grateful for in this moment right now? And it's the patients leave with that kind of aftertaste of gratitude at the very end. And it's so crucial.
Yeah, I look to appreciation is like us, we feel it like in the body or in the mind, but gratitude is felt in the heart. And so for me, I want to give things that are applicable here is like, when would I institute a gratitude practice? This is what I tell my patients. Your head's on the pillow. You're about to go to sleep. Before you go to sleep, you start to enter a hypnagogic state with your brainwaves. That's the perfect time to have your gratitude practice. Reflect on your day. Just say 1 or 2 things that you have gratitude for. Me and my wife will often do this as well. Even if the day was challenging, a 5-year-old son, kids, like they're tangential, they have different moods, of course. And so today might have been a very challenging day, but what do we still have gratitude for? And how do we ground ourselves in that moment? So then your last thoughts before you go to sleep are of gratitude. And what happens when you go to sleep, you're consolidating your memories in your hippocampus. So if your last thoughts are of gratitude, maybe you're pre-programming your brain before you go to sleep. Your brain's like a supercomputer. I call it the human operating system. So then maybe you'll wake up to more happiness. That doesn't happen after one time.
Sure.
But these are just little tiny habits that stack up over the days and weeks and months and years.
I think entering that dream state is really important.
100%.
And we can access a tremendous amount, because even before I'd opened up Reset Ketamine in Palm Springs, I was thinking about the name. what should I name it? Is it going to be called Palm Springs Clinic,
Perfect name.
Inland Empire Clinic, Southern California Ketamine Clinic? So
Yeah.
I was like brainstorming, and literally I had a journal next to me, and I wrote down, what should I name the clinic?
Yeah.
And that was the last thought I had.
Before you went to sleep?
Before I went to sleep.
Okay, cool.
Yeah, so it was around, I sleep pretty late, so I think it was like 11,
Yeah,
maybe
Me
midnight.
too.
So I wrote down that question in the journal right before I went to bed. And then at around, it was so strange. Like I just woke up at 4 a.m., just out of the blue. And I'm like, boom, reset ketamine. And I even had the logo.
Wow.
It just got downloaded to me where I was like, all right, it's going to have the reset button. It's going to have the wings. And it was through DreamWork, which is, we're in California, Arizona, woo land. But yeah, it was strange how just my unconscious was working on this problem or this question that I had posed. So going back to what you're saying, like the last things we're considering or thinking right before going to bed is a really powerful time.
If you tuned in to our episode today, chances are you're curious about the ins and outs of starting up a ketamine clinic. It's an exciting field, but let's face it, the journey from idea to actually opening day can be quite daunting. That's why we've created something special for you. Think of it as your personal roadmap, a free downloadable checklist that lays out the essential steps you need to consider when starting up your ketamine clinic. This checklist is designed to help you avoid common pitfalls and launch your trajectory to success. So how can you get your hands on this checklist? Simple. Just visit www.ketaminestartup.com/checklist and grab your free copy today. We've made it easy and accessible because we believe in supporting our community with a valuable resource. ketaminestartup.com/checklist. All right, let's get back to our discussion. Stay tuned and don't forget to download your free checklist during or after the podcast.
So on that note, like you're juggling a lot, James, right? You're juggling your family, you're juggling the clinic, you're juggling
2 clinics. Yeah.
Two clinics.
I think they got partners, Dr. Juan, Dr. Sharma. Shout out to those guys.
Yeah. So what do you do for self-care? Like how do you make sure that you are at the top of your game if you're able to? Some people are not.
Yeah. So I tell everybody, foundation for mental and physical health is nutrition, sleep, and exercise. Okay. So at least got to do those things. I do try to keep my nutrition pretty clean because I don't get as much exercise as I would like. I'll give you some things I actually personally do. I do athletic greens in the morning. Maybe it was Huberman or Rogan or Ferris that cut that into my routine. It finally did work with the marketing, right? I think you get marketed like 7 times before someone converts on average. So I do AG1 in the morning. I'll do intermittently, I'll do caffeine. I don't want anything to have a grip on me. So if I feel like I need it, cool. If not, this is me right now, no caffeine. Like I can get high energy without the substances. Just high on life, really. This to be alive right now is just such a blessing in so many different ways. And to be healthy, health is wealth. And number 2, for lunch, I'll do factor meals. Because I could choose keto or calorie smart or whatever. So I don't have to have my wife pack it and cook too much food or something like that. So it's just easy. Then my wife will usually make dinner for us. Thank you. Shout out to Doreen. Love you so much. Jacoby, the family. That's also part of how I really fill up my cup. The family, like being with my wife, my son. Like, dude, when I get a hug when I come home from my son, that is everything to me. It really is. And the other things I have is I have In Harmony's meditation cushion in my bedroom. So I'll do sessions of that pretty regularly. I also have the Shift Wave, which is a vibroacoustic zero gravity chair. And it's like a nervous system trainer. So I'll do a 30-minute meditation on that as well. Really cool technology. It's basically like using technology to biohack. And then, try to get in the pool in the summer times. We're in Arizona. Try to do a little exercise when I can, but at least try to get my steps in if I can't do it.
Sure.
At least move your own body weight around, do push-ups, sit-ups, that kind of stuff, pull-ups. And then sleep. Like, I need to get better sleep. I'm not going to lie. The past 2 nights, I haven't gone to sleep until like almost 1 in the morning.
Wow.
I'm just trying to get things done. Like, the constant notifications, the constant emails, right? Like all these things. And before you know it, like I'm packing for this trip and everything. It's 1 o'clock in the morning. I'm like, dude, I gotta be on point. I'm like, dude, sleep when you die. Steve Aoki mentality. So it's okay. Like I still got 6 hours. We made it here. Everything worked out. So really, yeah, just nutrition, sleep, exercise, family, the different technologies I use. Also like my own respite, like from the week. I allow myself to connect with cannabis on Fridays and Saturdays if I choose to do, because I'm using it as a way to reflect on my week and get introspective. And the stuff nowadays is just so strong that literally just like 1 or 2 puffs or an edible and just stop. Like usually times people have an adverse reaction to cannabis. It's just the dose. Like the dose makes the medicine or the poison essentially. So I will do that on Fridays and allow myself to then reflect back on the week, get introspective, get creative, using that as a tool, right? So anything you're doing in life, behavior or substance, is a tool or a weapon. Just ask her that. Are you doing it to connect with yourself or are you doing it to escape from yourself? That's a really way to delineate if it's a tool or a weapon in your life. Even love can be a weapon, right? So my family is everything. My mom, she's across the country for half the year, taking care of our 94-year-old grandmother. My brother, hang out with him, his family, my 3 nephews. So get us together. Yeah, like those are the things that really fill up my cup.
Man, James, I'm so happy that you're able to care for yourself because that's
you.
so important. Because I feel like when you are, that actually allows you to be the best physician for your patients.
100%.
Sometimes when historically, I would work in the emergency department and I've seen other healthcare providers who they're crispy, man, they're burnt out. And I'm like, they're talking trash about the patients or saying, hey, this person, I'm like, man, that person just needs a vacation. Like they need to take care of themselves. But when we're doing this ketamine work, and I think of it as a transformational medicine, we need to really be at the top of our game.
100%.
Right? And be 100% so that we can fill, like you had mentioned, fill our own cup so that we can help fill others.
Yeah, they're not going to want to have someone give them an infusion that looks like just like they're on their last leg here. Oh, geez, that guy doesn't have his life together. Then I definitely don't want to be getting an infusion. It's an energetic exchange when you're in there with the patient, but everything's also work in progress. So I'm always trying to fine tune. I'm trying to go from a dad bod to a father figure as well. So I need to work out again, get back into shape like I used to be. Like I'm going to be in Santa Monica. They have the rings there. I used to be able to do that. I'm going to challenge myself to do it again. This year. Just can you move your own body weight around?
Love it.
Have functional strength essentially. But even like with ketamine too, it's not a magic bullet. It's not a panacea. It's not going to fix you forever. It gets you unstuck. So all these like the daily practice is really the key, right? So having nutrition, sleep, exercise, but then do I have a meditation practice? Do I have a journaling practice? Do I get my thoughts, my clutter out of my head onto paper? I call it mental constipation. You got to vent sometimes. Then what is your community like? What are your friendships like? I call it through vitamin C is community, connection, consciousness, right? So there's different levels to this. So as far as reaching profound self-actualization, like Maslow's hierarchy of needs, and just realize, hey, is my foundation good? Because if it isn't, start there. And then now we start building upon it. Really good movie on Netflix called Stutz. He talks about a lot of this stuff too, that like that foundation. And then knowing like in life, there just like gravity is a factor of life, right? It's just a law of nature. You have to abide by it. There's 3 more like laws of gravity. Number 1, life's going to have pain. Physical and emotional, and suffering is the optional component. But you're going to have pain at some point in time. We're going to lose teeth, we're going to lose loved one, breakups, that kind of stuff. Number 2, life's unpredictable. And so you just have to realize that, sure, it's unpredictable, but you are in control of your response to any event, and that's going to change the outcome. And then number 3, life is constant work. And it just is, but work is when you're doing something, you'd rather be doing something else. So how do we like look at work as play? So that's why I try to look at the ketamine clinic. I'm like, dude, even if I've done 50 infusions this week and I'm just like burnt out, like I still try to look at it as play. Dude, I get to give this person a psychedelic experience. Like what honor and privilege. And like get to be a part of their story and they become part of my story. And so just remember like you 10 years ago would have killed to be here. Like the one that wanted to get into med school and wanted this so bad. So draw upon that prior energy and that drive that you had. Like for one of those doctors out there that are feeling like burnt out, remember before you got into med school, how bad you wanted it.
Yeah.
And then you got it. And so go back and tap into that version of you because that old you would be like, dude, suck it up, come on.
Yeah, totally. Sometimes I'll wear the white coat. I'm like, man, yeah, when I was in college, pre-med, like hoping to get an interview and like waiting, I'm on the wait list. Am I actually going to get in? Yeah, this is what we wanted. And now we have it.
Yep.
And having, again, going back to the gratitude, it's tapping into that older self or the younger self. So that's so important.
They say, careful what you wish for, you might just get it.
Yeah, true.
And then we got it. But we don't have call anymore. There's no nights, weekends, holidays. But like we allow ourselves, we're trying to get more vacations amongst us because we understand, like me and my partners, like mental health is crucial. So we need to practice what we preach.
Sure.
So we used to work Saturdays for 2 years. And then we stopped doing Saturdays this past year. And I was like, I don't think it's going to affect business that much, honestly. I think that we can cut out the Saturdays. We all get that break every 5 days max in a row. You have to pour into your cup. So yeah, please, everyone out there, do that so that you can pour out into your patients and the community around you.
And what's so cool, James, is that it's not just you working solo, but you have your 2 other partners.
Correct.
And in an earlier podcast, we had actually talked about being these 3 archetypes for business. And every business, whether it's a medical clinic, a restaurant, et cetera, you need these 3 archetypes. Just to recap, for those who haven't listened to that one, is there's the artist, there's the leader, there's the entrepreneur. So I wanted to ask you, because you have 3, you plus 2 partners, so that's 3 people. Tell us about which archetypes you and your partners are.
Yeah, beautiful. Episode 5, listen to it. You're dropping wisdom pearls there. It's really good. I hadn't heard of that until you did that as well. So I appreciate you putting that knowledge out there. I do consider myself my primary archetype as the artist, my secondary archetype as the entrepreneur. I look at my partners as well. Like Greg has the leader archetype, and then for his primary, he can pick his secondary. And then I look at Deepak as the entrepreneur because he has the MBA of the 3 of us as his primary archetype. And so we actually have all 3 pieces right there. I don't think we realized that going into it. So maybe that's part of why this also works as well. And then the other thing is I was talking to you before this aired is, and I just noticed this today actually as we were driving in, and my name is LEA. So leader, entrepreneur, artist right there in a row. But I think maybe sometimes I shy away from that role. Like I've always told people like growing up, I want to be the vice president, not the president. I want to have someone to kick the can to. But then as the anesthesiologist in the OR, you are at the helm, like you are the leader. Oftentimes I do find myself in leadership roles or responsibilities. So I think like I need to work on that and continue to embrace that as well. So try to have elements of all three. And I'm sure they have elements of all three as well. But I definitely say art is my number because visionary art's like, it's my thing. So yeah, if you're going to go into business and start a ketamine clinic, if you're going to do it alone, just try to have that little self-actualization. What am I of the archetypes? And then if I'm going to be partnering with people, what are their primary archetypes? You have synergy there so that your summation is greater than your individual parts.
And I think that was the challenge that I had. So before I had opened up the clinic, I was actually talking with 2 other doctors. One was an ER doctor, one was an anesthesiologist. And we were like in the early pre-seed stages and just talking about it. And I think we worked on it for maybe 2-3 months, but it just fizzled. And now that I look back, I'm like, oh, the challenge was all 3 of us were artists.
There you
and
go.
as a result, we didn't have those elements that you have, advanced wellness and pain with your partners. You have all 3 of those elements. So thank you for reiterating the need for having archetypes, knowing what you are. So knowing yourself and then partnering with people who can complement your strengths and skills.
Yeah, 100%. Yeah, I so much just gratitude for my partners, honestly, because as they say, if you want to move fast, go alone. If you want to go far, go together. And so I hope that we'll go far because the 3 of us together, we just wear different hats as well. And so one of us can take a vacation and then the other 2 can cover the clinics. But then also you feel guilty a little bit because you've left and they're doing the work because we split everything 3 ways equally.
Okay.
We do. But we also like Dr. Juan just turned 60, delayed shout out, happy birthday to him. And then Dr. Sharma is in his late 30s, 42. So that like we have different walks of life. We're all different races as well, different upbringings. So it's like really cool, like what we bring to the table here for patients. So I do like to give patients a variety. And we have a couple of nurses that work with us in the clinic because I think all of us have different talking points. And, I could be great for 2 or 3 infusions, but 6 of them, you might be like, okay, enough of this guy. Like, what's the other guy got to offer? Yeah, totally.
Yeah. I was going to ask you, since you began this journey, it seems like you've transformed a lot, although the core elements may still be there.
Yeah.
So since you've opened up the clinic, in what ways have you noticed that your mindset or personal outlook has evolved?
Yeah, I'm authentically me now. That's really what's happened. So I feel liberated because this is the same James, but I was in the medicine cabinet for decades. Actually, I met Rick Doblin and I said, Rick, I'm out of the closet with my psychedelic use. He goes, don't say that. Say you're out of the medicine cabinet. So I was like, I like that. I'm out of the medicine cabinet.
Shout out to Rick.
Yeah, shout out to Rick Doblin, man. Just a pioneer, a legend. Thank you for all the work you do. For real, it's a movement, and the people need this medicine. The psychedelics in general, MDMA, ketamine, psilocybin, all these different things that are coming out. So yeah, I hope August 11th, please, FDA, you got to pass that.
Actually, let's talk about this. This is coming up. So the MAPS, now known as Lycos, they actually sent in their submission and they were like FDA phase 3. And then now the advisory panel to the FDA rejected the MDMA application. And they said, hey, let's not FDA approve. So what are your thoughts on this?
I think they're incorrect, honestly. Look at the thing. Okay, number one is what are the alternatives right now? You got 2 drugs that are FDA approved for PTSD, Zoloft and Paxil. That's it. 2 SSRIs. That's what we can do for our veterans, really? And less than 40% effective and lots of side effects. Whereas like MAPS trials are showing like greater than 80% efficacy. And I think after a certain amount of time goes by, like over 70% have no longer meet the diagnosis for PTSD. So it does work. Nothing's going to work 100%. And there definitely needs to be like in a sacred container and do the therapy around it. So do it in the way they're doing it. And also, I don't know what the rollout's going to be like, honestly, because who can afford this? Like with 2 therapists, 3 8-hour sessions, 42 hours of therapy over 12 weeks, that's a lot. But still, I think we need to move this forward and pass it. And because the reason I said no is like expectation bias, right? Because like basically the patient knew that they were getting the MDMA. So I guess you could have had a third arm and have like an active placebo and give someone maybe like a flushing dose of niacin or benzodiazepine or something. So I understand that, sure. But they also did go to the FDA to help them design the study. So,
yeah, that's what I found mind-boggling was they had each phase. They were, talking with the FDA. And it's, why didn't the FDA, like one of their other rejections was, oh, you guys didn't get labs. Like we need a CBC, CMP, et cetera. And it's, why didn't they tell them during phase 2, oh, by the way, for phase 3, you should get labs so that we know what's going on. And then the other one was the allegations of sexual abuse, assault.
Yeah.
So that was another concerning factor.
That's definitely unfortunate. Like anytime you're going to give a psychedelic medicine, have cameras in the room. And I think that was caught on tape as well. I don't know all the ins and outs of it, but honestly, nothing's going to be perfect. And I just would encourage them to really rethink it. And honestly, just asking yourself, okay, we say we don't pass it. What are the alternatives right now? We have a lot of veterans leaving the United States to go down to Mexico and leave the country to access ibogaine, ayahuasca, different DT, whether it's NN or 5-MeO, as ways to basically just get unstuck from their trauma, to change the way the traumatic memories live within them. But I do think ketamine works the best for PTSD.
Yeah.
honestly.
So speaking of alternatives, ketamine was, I know a lot of people are like, hey, we need MDMA. And I do agree. I think it should be FDA approved. But while we're waiting, why don't we access IV ketamine therapy, which is legal? And it's not a classic psychedelic, but it is entheogenic, I believe. And
I agree with you.
Patients who have these non-ordinary states of consciousness. We've been prior podcast interviewees have mentioned that it allows them to access the same point as these other psychedelics.
Oh, definitely.
So what's available now? What's the alternative? IV ketamine is an option. Stellate ganglion blocks is another option for PTSD. So holotropic breathwork, Stan Groff invented that back in...
Stan Groff is so much admiration.
Christine Groff, because there was a moment when LSD became illegal. Stan Groff had been working on it. And he's like, how else can we create these non-ordinary states of consciousness? So
The Way of the Psychonaut, 2 great books, Stanislav Grof.
Yeah, long books.
If you're going to be on a deserted island, those would be some good books.
Yeah, Way of the Psychonaut, Part 1, Part 2. I'm actually listening to Cosmic Consciousness with Stan Groff. So I'm just like revisiting some of the classics. And I think one of the beautiful quotes from Stan Groff is he says psychedelics are basically the microscope to consciousness. Right?
Oh, dude, that's one of my favorite quotes of psychedelics. What the telescope did for astronomy, the microscope did for biology and medicine, and that's what psychedelics do for psychiatry, psychology, and human consciousness.
Yeah, because thinking about consciousness, because with the ketamine, you've seen and I've seen our patients have these altered states of consciousness and spiritual experiences and touching upon the divine. And speaking of perspective, like gaining that microscopic perspective and then zooming out and seeing the universe from the 10 million foot view. And it's, that change. I loved your thumb metaphor, your example, because they are gaining different perspectives.
100%. Yeah, with MDMA, even if they did approve it, what I like to shift the paradigm around MDMA is that imagine if ketamine is a way to prepare you for the MDMA journey, because there's no stop button in MDMA. And you might be going into that 6 to 8 hour experience, but on the dose, that's very challenging for people. So what if you did go through ketamine first if it was covered, and then you might not even need to go through MDMA, or you'd be better equipped to go through MDMA had you gone through the ketamine, and you get the neuroplasticity, the rewiring, you're starting the healing process. And I'm telling you, I really do think ketamine, number 1, PTSD, number 2, depression, number 3, anxiety, chronic pain syndromes as well, and then suicidal ideation. It's the most rapid acting anti-suicidal agent in all of medicine. Every physician should know that, honestly, especially guys in the ER, because you're going to see a lot of people in crisis. And just knowing that you have a real opportunity there to change someone very quickly, potentially, with a powerful medicine. But I was not taught that in med school or residency. It was something we discovered later on. So I think it's good preparation. Also, say we're going to legalize all psychedelics. I had this thought on, imagine if you had a psychedelic permit, like how people have a gun permit. So you have to go through a class, make sure you're approved and all these different things. Not just making psychedelics available to everyone without any little controls.
Like a license.
Yeah, like a license. Sort of, I've proven. I've certified that I can access non-ordinary states in a safe environment, because you should be able, if you can go explore outer space, why can't you go explore your own mind?
But before someone goes to outer space, maybe they want to get in an airplane first.
Yeah, exactly.
Prior to going to outer space. It's almost like graduating to different levels. And one of the things that Kim and I had talked about in a prior podcast, it's if someone has an infection, I'm not just going to use one antibiotic, right? I'm going to use multiple antibiotics and targeting. And one person's going to respond to one Keflex or cephalexin, another person's going to need Augmentin. You're going to need to figure out what type of bacteria or virus or fungus is causing an infection. So I think we need multiple modalities.
100%. Multiple. Not just one. 100%. Yeah. And so each of them have their strengths and definitely the different mechanisms of action. I'm really excited about psilocybin one day. If that comes online, please. I've told people, if I had 3 IV medicines, all right, the 3 that I'd want, IV ketamine, we got it, thank goodness. Number 2, IV psilocin. And number 3, IV DMT. You give me those 3, we're waking up the world, man, for real. And in controllable manner as well.
I would add in, just from the ER's perspective, IV Zosyn and IV Dilaudid.
Yeah, for the antibiotics and vitamin D.
Let's get controversial here, because ketamine is great. You and I we were preaching to the choir for at least the two of us.
Yeah.
But there are some controversies, right?
Of course, yeah.
Of course, you may have heard about Matthew Perry, right? And now
It's an unfortunate situation, really.
he passed away. He drowned with very high doses of ketamine. And I just read an article recently. Now they're trying to figure out like who gave him the ketamine, and how are they going to start criminal charges. So have you heard about this? And
yeah, I heard they're trying to explore that. I also find it, I'll leave anonymously here, but I talked to a doctor who actually treated Matthew Perry in the ER, and they brought up a good point to me. They said, interestingly enough, they didn't find any ketamine in his house at all. Why was there no ketamine left behind? Was it a potential suicide? Just asking the question. If you died from an accidental overdose, wouldn't there be some drugs left over? Interesting, right? And then he had buprenorphine in his system as well as benzodiazepine. So it was the multimodal approach there. It wasn't the ketamine alone, but what gets the headline, acute toxicity of ketamine. It gives us an opportunity right now to raise awareness around a tragedy because we can't change the past and what's happened, but we can learn from it and make sure it doesn't happen again. And even like just the huge at-home ketamine industry as well, which that's a whole podcast in and of itself. So I don't want to go down that rabbit hole essentially, but I think honestly, the safest way to do ketamine is in a clinic with a licensed practitioner, someone that has extensive experience with ketamine, ER, anesthesia, psych NPs, like people that have worked in the mental health space, that understand this medicine. If they've had personal experience with it as well, that's helpful. I have an analogy often, like I wouldn't go to a virgin sex therapist. So I think me, in a way, I created things because I've journeyed with the medicines. I think it's important, or at least have some psychedelic journeys under your belt so you know what it's like to access a non-ordinary state, because it will change the way you practice. Just like I had anesthesia done to me when I was 21 for my appendix, and it changed profoundly the way I practice anesthesia. Why? Because the guy didn't put lidocaine in my IV with propofol, so my arm was on fire. Ooh. And now I know that, put lidocaine in propofol. It takes 2 seconds if you have a lazy anesthesia provider if they didn't put lidocaine in the propofol. Number two, everyone was talking and laughing as I was going to sleep. During induction is a sacred time. There shouldn't be laughing and all this like background noise, because I had contacts at the time. I had LASIK sense, so I couldn't see anything. I was like blind. People were laughing. I'm cold. Like they didn't warm me during the procedure, so I'm shaking and shivering when I woke up. So that experience changed the way I practice anesthesia profoundly. I would allow patients when it was an emergency situation to pick their own music that they go off to sleep to in the OR. And I would tell them everything that's happening and made sure everything was nice and quiet. It's like a sacred time. So even as they're waking up, your first faculty that comes back online is your hearing, even before you're really aware. So someone might seem like they're still asleep and you got the tube in place. Their hearing is going to come back first. So just be mindful of these things so that my personal experience, life's all about experience, man. It really is this game of life. So just utilizing these things to make you a better practitioner, to take things to the next level, always keep evolving what you're doing as well. That's like me, Greg, and Deepak, like my partners, like when we started out doing this in 2020, you'd have 3 board certified anesthesiologists in the room with one patient. One would start the IV, one would do the intention, the breath work, the meditation, one would write the note, and then we'd rotate. And then you had 3 docs in a room during 2020, and we were just brainstorming. And that's how we evolved what we do to where it is today. And that we were open to constructive criticism and feedback. And we have a little mini democracy because it's 2 versus 1 if we're voting. So I do like those checks and balances. Like that quote says, we'll go farther together versus just going fast alone. Yeah, man, I could talk to you for hours. This is amazing.
Well, do you guys have, some of the people listening to this may be thinking about working with partners.
Yeah.
And as with any marriage or relationship, like things can end. And as a result, some people will sign like prenuptials, for example.
Yeah.
So did you guys think about that and pre-plan? Hey, just in case one of us wants to leave. I think you mentioned a 4th doctor.
Yeah, she left the pain. We were doing pain sedation. Yeah, she's up in, I think, Seattle, perhaps.
So I'm wondering, would you have any advice for someone who is planning on starting it up, but working with multiple partners and say, hey, maybe someone wants to leave for XYZ reason. Like, how would you guys reconcile that?
Yeah, if you start off, the best time to have any conversation is before the problem happens. You could have an operating agreement in place. We need to do that still. Like, we've all been pretty verbal and we're all just like pretty honorable human beings. So we trust one another. But just realizing, okay, there's a saying, I think it was like Sheryl Sandberg, she's like number 2 at Facebook for a while, is that the progress of any relationship, whether it's like personal or business, is directly proportional to the number of difficult conversations you have. So just know that when you're having those difficult conversations, it doesn't mean that you should end. It's just that you're probably having growth there. There's an opportunity to learn. Every obstacle is actually an opportunity in disguise. But just know that, yes, if I'm going to go into business with this person, are they also a physician? Are they more just like the money behind it? Because you're going to wear different hats and there's going to be like a little bit of resentment possibly if you feel like, hey, I'm doing all the work here and they're taking the money. So just what are your roles? What archetype are you? What's our long-term game plan? Like putting that on paper. If you want to sell one day, I just want to keep doing this and I don't know where the future is going to be. But 5 years ago was 2019. I was in the hospital still. And here I am now. So I don't know what's going to happen in 5 years from now. I really don't. And also cool to think like, where is my life going to be 5 years from now? Don't worry about it. That's anxiety, right? Worrying about the future, right? Depression, dwelling on the past. So just get present, but also plan for the future. I told my patients, like, don't call it anxiety, call it future awareness, future preparedness, right? I'm not a germaphobe. I'm germ conscious. I'm germ aware.
Yeah.
Because you can't just be present. Yeah, you can't be present all the time. Then you're just going to be blindsided by the future. So with partners, if you're exploring that, say like there is a financial commitment here, like you're going to sign a lease potentially. We signed a 5-year lease on our current building that we're in Scottsdale with a non-profitable business. I don't know what we were thinking, but I think I always knew in the back of my mind, I was like, yo, you're an anesthesiologist. You could always go back and do anesthesia. Great plan B. And I had paid off my student loans. So I was like, all right, let's roll the dice.
Good
Take a
for
chance.
you. Yeah. And you are right. If someone opens up a clinic and for whatever reason they want to change or they're not feeling it or it goes out of business, like the plan B is, hey, I'm just going to go back to the hospital. I'm going to go back to the ER. It's almost like having that kind of safety or the safety net. So even if the business for whatever reason doesn't do well, hey, your safety net is to go back and being a doctor, which is not a bad safety net.
Totally. Exactly. Yeah. I have another pro tip is that, and we did this as well, slow transition into ketamine, right? So it took us 2 years to go full time in our ketamine clinics. So we still would work as anesthesiologists, like 2 would be in the clinic and 1 would be out doing anesthesia. So know that with ketamine, a lot of times you're not doing treatments every day so that you could limp into this and say you did the clinic Monday, Wednesday, Friday, or like Tuesday, Thursday, Saturday, or something like that. So that you could then start to see if it's growing. Because the hard part with this is that you think you're going to open it and patients are just going to show up. Sorry, that's not how it works. Like you got to market it and it's very challenging, honestly. And there's going to be ebbs and flows in the business. Like right now it's the summertime. We definitely are seeing a summer slowdown. I don't know if it's just like election year, the economy and inflation, just the season. I don't know, but I do trust that like mental health, honestly, we're in a mental health epidemic. So ketamine is a viable option. And then you also had a really good podcast about talking about, can your city support a ketamine clinic, right? And doing that math out that you did. So go back, reference that episode, because I think that it was a good way to get granular with it. And I was like, oh, the numbers work, like looking at it, but you're going to have competition in the area, but that's okay. Like just in ketamine, like everyone does a little bit differently. I think that's what's cool about it. It's the art of it. And just really always go back to what's my driving force to do this? Do I really want to make an impact and help people? Do I really believe in psychedelic medicines as this next frontier for mental health? Or am I just doing it to make a buck? Then don't do it if that's your
totally. If it's just to make a buck, it's
don't do it.
No, it's just better to stick with what you're doing because
I could make more doing anesthesia.
Yeah,
really
clinically you could do better. I could work in the ER doing 10, 20, 15 shifts, whatever a month, and that actually be
and pay's gone up since we've got into this. Too.
Yeah. But I don't think it would be as emotionally, spiritually nourishing for me to do ER.
It would not it's not make a guy. Yeah.
Would you ever go back to anesthesia?
If I'm back in the hospital, that means I failed at this. But I will have learned. So it's win or learn. It's not win or lose. So I do not plan to go back and do general anesthesia practice. I hope to evolve within this field. And like I want to be the expert of ketamine. That's my niche. Even if MDMA was FDA approved, like I don't necessarily want to just roll it into my clinic right away. I'd partner with people that are doing it and say, hey, why don't I prepare your patients for the MDMA? This is my lane. I'll stay in this lane. Because I just rather watch it play out.
Sure.
I do want it to pass, but also I'm not going to be in a rush to get it into the clinic because it's just the application of it, I think, is going to be very challenging. And what insurance company is actually going to pay the 15 to 20 grand that's estimated
I think
to go
once
through
it does become FDA approved, the insurance companies are required to cover it. And the last I heard it was, I don't know, 20 grand, 25 grand or something.
It's a lot of money, man.
The entire,
And you still have a deductible to pay.
Yeah. And it's also very time intensive, as you had mentioned, 6, 7, 8, 10 hours. I know some places are like spending a night there as they're getting the MDMA, requiring 2 healthcare providers. I think one needs to be a psychologist, therapist. The other one doesn't have to be. But yeah, it's very human resource intensive, time intensive. So that's one of the challenges of MDMA therapy that I see because where there's already a healthcare shortage.
Yeah.
So we're going to switch gears and do some fun questions, James. So let's start with this one here.
People listening right now, though, like we're very tangential. So hopefully you followed us in this. Thank you for listening this far. And that, like, me and Sam could talk for literally 5 hours on a podcast. Maybe one day we'll try to do a marathon.
We'll do like a Joe Rogan 4-hour podcast.
Yeah.
So this one, if you couldn't be a physician and anything, you could not do anything in healthcare, but you still had to have some career, something to do, what would you do instead?
Honestly, I've thought about this before. 2 things. I'd either be an airplane pilot because anesthesia is like flying the plane, like when you take off, that's induction. And then when cruise control is when you're asleep and then the landing is the wake up. So I feel like I could do that as well. Plus, I would love to just watch a sunrise and a sunset from the cockpit and then be able to travel around the world. Or I'd work in basically travel. So I'd be in some hotel, resort, some tropical destination. Like that's why I live in Arizona. Man, I can't do the cold. I just at pilot or in some sort of travel vacation destination industry. Creating experiences. I'm a curator of experiences for sure.
If you had a billboard and millions of people are going to see this billboard, what would you write on that?
Me versus me. Because that's for all of us. It applies to every single human being. It's you versus you of yesterday. You're not in competition with anyone else. That's an illusion, right? Even if you're in the Olympics and you're trying to get a gold medal, you're still just trying to be the best version of you. So me versus me is what I'd have on there because they want 7 words or less on the billboard. That's what I would have there. And it's on my bracelet too.
I love it. Tell us, what are 3 books?
So I thought about this, and one that me and my wife, we have a little book club, which is neat. It's called Journeys into the Bright World. And it's by this lady, Marcia Moore and Howard Altunian. And he was an anesthesiologist. He's no longer alive. I don't know if he's still alive or not, but it was written in 1978. And it chronicles their love story as well as their affliction with ketamine. So it's got really amazing just grammar. The words are just so verbose. Like, it's really cool. So we haven't gotten through it yet, so I would continue reading that. The other one I would do is Alex Gray has a trilogy of books, and one of them is Net of Being. So I brought that with me. So I would have Net of Being there for the people watching. I would also have Sacred Mirrors, his other one, and then I would have the one Transfigurations. So there's beautiful art there, and then there's also a lot of very profound words and thoughts and ideas in there as well. So I wouldn't just have words to read. I would also have things to look at. Because even this picture right here, this is Net of Being, it's like galaxies in here. So what if we zoomed out, what if he's bringing back like what actually, it's all like Indra's net. Like what if he's bringing back that into, so that we can experience it. So really what they said is like the best technology we currently have to bring back imagery from the psychedelic spaces is visionary artists. So visionary artists, I think, are a necessary part of the psychedelic medicine movement. So many amazing ones out there. Alex and Nelson Gray, Amanda Sage, the list goes on. And I'm not going to keep laying all the names because there's just so many. Just really appreciate all of you guys out there. There's so much visionary art in the clinic. It is a necessary part of this medicine movement.
I think we're going to have to bring you back on for part 2 because there's so much more we could talk about. But I get
questions from the audience.
Yeah, I do have one last question, and I know the answer, but I'm going to ask you anyways. And it's regarding, do you have a hidden talent or hobby that most people would be surprised to learn about? And I make up, I could be wrong.
Yeah.
For me, I've known you for many years now. And you are a lyrical poet. You're a genius. You have a beautiful way with words, James.
Yeah.
So if you're up for it, would you be up for doing a little rap for us?
I would do a rap to wrap it up, but I also want to hit that third book real quick, is What's in It for Them, Joe Polish. Shout out to Joe Polish Genius Network, because think about whenever you're doing something, what's in it for that other person? Not you, but what's in it for them. I think it's an important thing to realize. And then back to the hidden talents, got a few of them. So I cut my son's hair. So I'm a barber, but not formally trained, just in my own skills. And number 2, I could do the alphabet backwards. So I'll do that for you in a moment. I could juggle 3 balls. And then, I do rap a little bit as well. So we'll start off with the alphabet backwards.
Okay,
ZYX, WVUT, SRQP, ONM, LKJ, IHG, FEDCBA. So there you go, the alphabet backwards.
He actually proved it.
Yeah, I learned that in accounting 101. I was so bored. I was like, I'm going to learn something in this class. And so every day I'd write the alphabet backwards. No offense to the accountants out there. I was like, I had to learn something. And then, the rap. All right, you're listening to the legend of a street pharmacist turned anesthesiologist. Listen up, Sam. Class is in session. You ain't about to be dismissed. I turn my personal itch into my occupational scratch. I'm just here to get human consciousness lit like a match. There ain't no catch. Hi, they call me Dr. James. I got psychedelic blood evolution in my veins. I'm here. I came from far away. I'm a luminary now, making moves, influencing your brain waves. I've been dreaming about infusions for a long time. Had a vision from Alex Gray, Amanda Sage down a cosign. Artificially intelligent new AI. I'm your future, past, and present. I'm a fine line, and I'm the missing link to this illusion. Sam, I am not really here. I'm an intrusion. I don't swim or sink. I just flow. I don't need gravity. I'm here because my business and the global collective consciousness need growth. Oh, whoa, when I infuse, there's an epic rumble, and I would never fall or stumble, and I don't need to be humble. Break down problems and solve them like the Ketamine Startup Podcast. Come on. There you go.
Wow, we are going to wrap up, but before we do...
That was a wrap up right there.
Yeah, that was a wrap up. Before we wrap it up, is there any other last thoughts, comments, questions, concerns, anything else you want to share with me and the audience?
I would love to have a part 2 of this in the future. Number 2 is that this is for you, Sam. Thank you so much for real, man, for creating content, for being one of the pioneers in this space. You're the voice of reason. You're evidence-based. like you can tell you're leading with your heart. So that's what I just want to say is take a moment to say thank you. Like you're running this right now solo. Like people don't see that, but you're running this whole thing solo right now, and you're just really leading with your heart. You're an amazing spirit in human form, and it's an honor and privilege to know you and be conscious with you at this time-space continuum. So just really, I appreciate you. And if you guys want to check me out on Instagram, psychedelic_DRS, you gotta write that whole thing out because I'm probably shadow banned because that psychedelic word is what's naughty, but not really. So yeah, just thank you. And hit us up like 480-631-4800. We do free phone consultations, info@advancedwellnessandpain.com. We are here to help you. We really are. And know that if you've lost hope, have you tried ketamine yet? I understand it's expensive, it's not covered by insurance, but we do have financing options to try to work with people and get yourself unstuck because you got one life for sure. And you need to reach out there and we will try to help you in any way that we can. So thank you, Sam. Thank you for people for listening that made it over to here. And I want to do a part 2, maybe a part 3. Like me and you were like Duncan Trussell and Joe Rogan of ketamine.
Yeah,
like,
definitely.
awesome.
Definitely part 2, 3, 4, 10. Fast and Furious.
I love it, dude. Love it.
Yeah, and we will put in all the links in the show notes, the contact information. So if you weren't able to write those down, just check the show notes because we promise we'll include every link that we discussed. And thank you for being here, James. Thank you for being you and being your authentic you.
Thank you. You as well, man. Ditto. Let me shake this amazing man's hand right there. I'm also going to give you one more present here. I'm giving you the Me vs. Me bracelet. So are you part of the rave community at all back in the day? Just,
Not
you know about
really,
Plur? You know about Plur?
No.
Have you heard
No.
of Plur? Plur? Okay, so you're going to put up your peace sign right here. Peace, and then L is love. Do like this. Love, and then unity, and then respect. All right, and then I pass the candy or the bracelet onto you so that you can now know that in all of this, it's only me versus me.
Thank you so much. I will wear this with pride and me versus me. It's so true, man. Thank you, James.
Yeah, you're welcome. Thank you, Sam. Thank you. Thank you, listeners. Peace.